A lot of patients will come in and say they want the least invasive surgery and they want something that's very safe, that maybe they can even go home the same day after surgery. And the laparoscopic adjustable gastric band system is that surgery. And around 2000, that became the rage and the popular surgery to do. And the concept was excellent. You put a special silastic ring around the upper part of the stomach that creates a 4-ounce pouch, kind of like an hourglass if you think about it. And on the inside of that silastic band is a balloon that's connected to a tubing that runs to a port that sits under the skin on your abdominal wall. That port allows us to put fluid into the band, and since the balloon is on the inside of the band, when you put fluid in, it takes the size of the band from the size of a $50 to the size of a pencil. Again, if you kind of think about it, it's like a hourglass, but that's really not how it works. So you eat 4 ounces of food when the band is appropriately adjusted, the size of a pencil. It takes time for that food to go through the band. That sends all kinds of messages to your brain that I'm full, because as the food goes through the band and it pushes against the wall of the stomach, it sends all kinds of hormones and neuroendocrine signals to the brain that I'm full, kind of like eating a Thanksgiving dinner. And we know how miserable we are after that. So the band works in a very different way than the sleeve or the bypass, but does have some of the same characteristics that when food goes through the band and it pushes on the wall of that stomach, all of those signals are sent to the brain saying, I'm full, that's enough. Unfortunately, the problem with the band is we found that it has a very, very high reoperative rate, which means once a patient has the band, they can develop some scar tissue underneath it that can require surgery because the band will no longer work because that scar is not compressible when you put fluid in. And some patients become very intolerant of their adjustments. You put just a little bit of fluid in and all of a sudden they can't eat anything. So it's a very safe, very effective operation, but it does have a higher reoperative rate. One of the most common operations we're doing now is taking the band out and converting it to a sleeve or a bypass.